Hello, everybody. My name is Akila Augusta, and my ethical dilemma is called When Duty and Belief Collide. And I chose to focus on personal values versus professional obligations in oncology nursing care. And I really like this topic because I think that this is one of those situations where knowing the rules and knowing the ethical principles is one thing, but actually being the nurse standing in that room with the patient is completely different. Because what happens when you genuinely believe your patient is making a decision that you know could hurt them, but ultimately it's their decision. So that's what we're going to talk about. So we're defining the dilemma here. Here's our dilemma. We have a patient with cancer who has been going through chemotherapy and she's having some pretty severe side effects. Eventually, she decides she doesn't want to continue chemotherapy anymore. She finds a holistic cancer program online and decides that she wants to stop chemotherapy and use an herbal supplement regimen as her primary treatment. Now, as the nurse, immediately you're concerned because you know what the evidence says. But at the same time, this patient has a right to make decisions about her own body. So we have autonomy on one side and beneficence and non maleficence on the other. And when the nurse feels like, I know I have to respect this decision, but I also feel like this could really harm my patient, that can create moral distress. And this isn't something that's limited to oncology. We can run into situations like this in oncology, hospice, long-term care, really anywhere patients make choices that we may not personally agree with. So this is the case study. Let's meet the patient. And let me tell you a little bit more about her. She's young, she's active, she's very lively. And then cancer and chemotherapy come into the picture. The side effects have really started taking a toll on her. And you know how it is with our generation. We have access to everything online. You look up one thing, and suddenly your whole algorithm is showing you videos, testimonials, different treatments, holistic therapies, everything. So she starts doing her own research and she comes across this holistic cancer program that promotes an herbal treatment regimen. After looking into it, she decides, you know what? I don't want to do chemotherapy anymore. I want to try this. And there's an important distinction here. She isn't asking to use herbal therapies along with her chemotherapy. That would be complementary therapy. She wants to replace the chemotherapy with this herbal regimen. That's where the nurse becomes concerned because chemotherapy is the evidence-based treatment in this case. While this herbal regimen hasn't been established as an effective standalone treatment for cancer. So imagine being her nurse. You're thinking, oh my goodness, I really don't think this is a good idea, but it's not your decision. And that's where the ethical conflict really begins. So now that we know what's happening, let's put the professional terminology behind it. First, we have autonomy. Autonomy means that a patient has the right to make informed decisions about their own healthcare, even when the nurse, the doctor, or everybody else in the room disagrees. Then we have beneficence and non-maleficence. Beneficence is our responsibility to promote good for our patients, while non-maleficence is our responsibility to prevent or avoid harm. So you can see why the nurse feels stuck. She's thinking, I know what the evidence says. I know what could potentially happen if you stop this treatment. I want to protect you. But the patient is saying, I understand that. And this is still what I want. Neither principle suddenly stops mattering, but matter at the same time. And that's exactly why this is a true ethical dilemma rather than just a disagreement between a nurse and a patient. So, step one, because we have a 7-step process in recognizing everything. Step one is recognizing the problem. So now we're going to work through the 7-step ethical decision-making process. Step one is simply recognizing the problem. And this part is important because we don't want to label her as, a difficult patient or say, she just won't listen. That's not the problem. The problem is that we have a competent patient exercising her right to choose while we have a nurse whose training and professional responsibility are telling her to prevent harm. Once we recognize that this is an ethical conflict rather than just a patient making a choice we don't like, we can actually start working through it appropriately. Step 2, gather relevant information. Step 2 is where we need to slow down and actually gather information, because before we decide that this patient is making some terrible decision, we need to understand why she's making this decision. First, does she have full decision-making capacity? Has the oncologist explained her prognosis with and without chemotherapy? Does she understand that the herbal program she's considering has not been proven as a standalone treatment for her cancer? Then I want to know what's really driving this decision. Is she saying, I can't take these side effects anymore? Because if that's the case, have we explored everything we can do for every symptom? Have we discovered the symptom management? Is there mistrust of the medical system? Are there cultural or spiritual beliefs involved? We also need to know whether any of these herbal products could interact with her medication or create additional safety concerns. So we're not trying to talk her out of the decision during this step. We're making sure that her decision is voluntary, informed, and consistent with her own goals. Step 3, examine personal values. Now, this step is really about the nurse because we're human too. You can know everything about autonomy and still be standing there thinking, girl, please don't do this. And having that feeling doesn't automatically make you a bad nurse. That's where moral distress can come in. You care about this patient. You know what the evidence says, and you're worried about what could happen to her. But here's where professionalism matters. That fear cannot turn into pressure, guilt tripping, arguing, withdrawing emotionally, or treating the patient differently because she didn't make the decision you wanted her to make. The nurse has to be able to separate, I'm worried about you, from, I get to decide what's best for you. Those are two very different things. Step 4, develop a problem statement. So after we've looked at the patient's situation and our own feelings, step 4 is developing a clear problem statement. And basically our question is, how can I respect this competent patient's informed decision to discontinue chemotherapy while still fulfilling my professional responsibility to educate, advocate, promote benefit, prevent harm, and provide safe, non-judgmental care? And I like putting it into one question like this because now we're not focused on how do I convince her to change her mind. That's not our goal. Our goal is figuring out how to care for her ethically after she's made her decision. Step 5, list possible actions. So now we look at what the nurse can actually do. We can continue providing evidence-based education. We can explore why she wants to stop chemotherapy. We can make sure the provider is aware of her decision, consult the appropriate resources, and continue giving her, again, non-judgmental care. And if the nurse is experiencing such a serious conscience-based conflict that she truly feels she cannot continue caring for this patient appropriately, she can seek guidance and possibly request reassignment according to facility policy. But, and this is important, that cannot result in patient abandonment or a delay in care. So even when a nurse has a strong personal feeling about the decision, there are still professional boundaries and responsibilities that have to be maintained. Step 6, decide and implement. Now we actually put our plan into action. First, we're making sure that she has decision-making capacity and that she has received and understands all of the necessary information. We're going to document these conversations through and through, thoroughly and objectively. We're going to notify and involve the provider. And if we need additional guidance because the ethical conflict is still difficult to resolve, we can involve the ethics committee. But most importantly, we're going to continue giving this patient the same compassionate, respectful, and say it with me, non-judgmental care that we would have given her if she had chosen to continue chemotherapy. Because respecting her autonomy doesn't mean that we stop advocating for her. We can actually do both. Now, step number 7 is evaluate the outcome. Then we get to our final step. And we're not evaluating whether her herbal treatment worked or whether she should have listened to us. That's not really what we're evaluating here. We're looking at how we handled the ethical situation. Did she continue receiving accurate information without judgment? Was our documentation clear enough to protect her decision and our own professional accountability? Did we acknowledge and work through the nurse's moral distress? Or did she carry that frustration into the next shift and possibly into the care of other patients? And finally, if another patient made a similar decision tomorrow, would we handle it the same way? That's where reflection becomes part of professional growth. Professional responsibility. Now, what happens if you're the nurse and you still have serious ethical concerns? We have a professional process for that too. You will start with your charge nurse or immediate supervisor, and your documentation should be objective, facts, not I think this patient is making a horrible decision. If necessary, the concern can be escalated through the chain of command, and an ethics committee can become involved when there is a genuine values conflict. The ANA Code of Ethics is also part of the professional foundation that guides us in situations like this. And if concerns continue to be ignored, there are additional levels of escalation, with the State Board of Nursing being a last resort when appropriate. But communication matters through all of this. Instead of walking into the patient's room ready to correct her, I might say, help me understand what made you decide that you don't want to continue chemotherapy, because now I'm listening. I can still educate her. I can still advocate for her. I can still explain the risks, but I'm not fighting her for control over her own healthcare decisions. So when I bring everything back together, I think the biggest thing I've learned from this dilemma is that respecting a patient's decision doesn't mean I have to agree with it. If my patient has decision-making capacity, has been properly informed, understands the risks and alternatives, and still decides this is what I want, she has the right to make that decision, including refusing or discontinuing recommended treatment. My responsibility as a nurse is to educate, advocate, document, communicate with the healthcare team, and provide safe and non-judgmental care. And yes, I might experience moral distress because I'm human and I care about what happens to my patient, but I can't make her decision about me. I think that's probably the biggest lesson I would carry into my own nursing practice. I can advocate for my patient without taking away her autonomy. Sometimes being a good nurse isn't getting the patient to make the decision you want them to make. Sometimes making sure they're informed, making sure they're safe, and continuing to show up for them even when they choose differently than you would. Here are my sources. Thank you so much for listening to me.